CMA Certification Exam 2026 Complete Study Guide Mock Test Walkthrough. Question 1. Which color tube is used for a complete blood count, CBC? Lavender, red, light blue, green. A lavender top tube contains EDTA and is used for hematology tests like a CBC. Question 2. Which site is most commonly used for intramuscular injections in infants? Vastus lateralis, deltoid, gluteus maximus, dorsogluteal. The vastus lateralis muscle in the thigh is the preferred site for IM injections in infants. Question 3. Which hormone is primarily responsible for regulating metabolism? Thyroxine, insulin, adrenaline, cortisol. Thyroxine, T4, produced by the thyroid gland is the primary hormone regulating metabolism. Question 4. What does the medical abbreviation NPO stand for? Nothing by mouth, new patient order, no physical overexertion, normal pulse oxygen. NPO stands for nil per os, which is Latin for nothing by mouth. Question 5. The primary function of red blood cells is to transport oxygen, fight infection, clot blood, regulate temperature. Erythrocytes, red blood cells, contain hemoglobin which transports oxygen to body tissues. Question 6. HIPAA primarily protects which of the following? Patient privacy, healthcare worker safety, medical billing rates, hospital hygiene standards. The Health Insurance Portability and Accountability Act, HIPAA, ensures the protection and confidentiality of patient health information. Question 7. A patient presenting with a bluish discoloration of the skin is exhibiting cyanosis, jaundice, erythema, pallor. Cyanosis is a bluish skin color that results from poor circulation or inadequate oxygenation of the blood. Question 8. Which schedule of controlled substances has the highest potential for abuse? Schedule I, Schedule II, Schedule III, Schedule IV. Schedule I drugs have the highest abuse potential and no accepted medical use. Question 9. What is the standard lead configuration for a resting ECG? 12 lead, 3 lead, 5 lead, 15 lead. A standard resting electrocardiogram, ECG, uses a 12-lead system for a comprehensive heart view. Question 10. Which term means inflammation of the liver? Hepatitis, nephritis, gastritis, dermatitis. Hepatitis specifically refers to the inflammation of the liver, often caused by viral infections. Question 11. Which of the following vital signs is considered the fifth vital sign? Pain, oxygen saturation, weight, pupil dilation. Pain is widely considered the fifth vital sign and should be assessed along with standard vitals. Question 12. The autoclave uses which mechanism to sterilize equipment? Steam under pressure, dry heat, chemical vapor, ultraviolet radiation. An autoclave uses highly pressurized steam to achieve temperatures sufficient for sterilization. Question 13. What does PRN mean on a prescription? As needed, every morning, twice a day, immediately. PRN originates from the Latin pro re nata, meaning as the situation arises or as needed. Question 14. In the chain of infection, what follows the infectious agent? Reservoir, portal of exit, mode of transmission, susceptible host. The chain of infection starts with the infectious agent, followed by the reservoir where the agent lives. Question 15. When performing CPR on an adult, what is the recommended compression depth? At least 2 inches, 1 inch, 1.5 inches, 3 inches. For effective adult CPR, chest compressions should be at least 2 inches deep. Question 16. What is the normal range for adult resting heart rate? 60 to 100 bpm, 40 to 60 bpm, 100 to 120 bpm, 120 to 140 bpm. A normal resting heart rate for adults ranges from 60 to 100 beats per minute. Question 17. The normal range for a fasting blood glucose level is 70 to 99 mg/dl, 100 to 125 mg/dl, 126 to 150 mg/dl, less than 50 mg/dl. A normal fasting blood glucose level is generally between 70 and 99 mg/dl. Question 18. A sphygmomanometer is used to measure what? Blood pressure, blood glucose, heart rhythm, oxygen saturation. A sphygmomanometer is the medical device used to measure blood pressure. Question 19. What is the correct angle for a subcutaneous injection? 45 degrees, 90 degrees, 10 to 15 degrees, 180 degrees. Subcutaneous injections are generally administered at a 45-degree angle, or 90 degrees depending on needle size. Question 20. Which of the following describes the supine position? Lying flat on the back, lying flat on the stomach, sitting at a 45-degree angle, lying on the left side. The supine position involves lying flat on the back, facing upward.